If we want to discuss the common effects of abortion trauma, we really need a solid place to start. And a place that's probably simple for people to understand and digest is really the best place I can think of, is that it doesn't matter what the doctor thinks, what the government thinks, what the community thinks. These suffering men and women have an innate belief that the abortion experience resulted in the loss of their unborn. And to them that loss was significant. As well-meaning as we are, the more that we go into feel-good platitudes like, you can have another baby, it wasn't really a baby, it's just a clump of cells, or you'll get over it, just give it some time. The more that the suffering person is being wounded and being dehumanised, the more that we're silencing them and we're really shutting them down. And these women don't often see the dehumanisation because they are just so hard on themselves and very, very unforgiving. They'll often say that after the abortion something just wasn't right. The common thing that women report after an abortion experience is just that general loss in the joy of living. That is a very, very common thing that you will hear, certainly at abortion trauma recovery. They sort of keep thinking things in their head, I'm going to beat this, I'm going to beat this. And they keep working to maintain a level of denial that's going on in their heads. It was just a fetus, it didn't mean anything, head stuff like that. And others around them are supporting it and reinforcing it almost to keep a comfortable balance with what's going on. But after a while, it gets to the point where it's not working anymore. Those feel-good platitudes, they're not helping, and it's not helping putting it on them. The wounded person needs to deal with the conflicts that they are struggling with. They need to take ownership of how they really feel. Any zookeeper or game park owner will tell you that probably the most dangerous thing you can do is get between a mother and its young. And nothing prepares you for the feelings that come with parenthood or parenthood in general. It's not uncommon for people to be bonded to their unborn, regardless of the wantedness or the gestation. And I think as a community we tend to be desensitised to this as a way of rationalising what's gone on or what's going on around the abortion experience. And we're still, learning so much about abortion grief, abortion trauma, because it's a new frontier in healthcare. But what we have learnt here at Abortion Trauma Recovery over the last 40 years is that abortion tends to leave three major wounds. And that first wound is the loss of the unborn, that death experience that we just spoke of. And the second is the loss of self. So a fracturing of identity, if you will. Women often say that they can't be the same person as before they walked into the abortion clinic. It's like they've crossed an invisible barrier that they can't return from. And that's their words, that's how they explain it. There's often so many things going on around in their head, and how the women describe the death experience of their unborn can be quite gut-wrenching at times, even, for the most hardened person. But they have to talk about it and they have to share it in the way that they need to. And the third wound is a spiritual loss. And so everybody, I suppose the best way to explain is that everybody has a value system that helps to keep us in check. Whether it's a formal structured religion, the universe, or whatever it is, the abortion decision and the experience often causes a shock to that value system. And as it's generally bonded to our ability to heal and to rebound from the experience, it often leaves people with more questions than answers. So the common effects of these wounds, of the abortion trauma, is the denial and suppression of the abortion experience by the wounded person. Denial is a protective mechanism that we use to get through a crisis. And if you know a lady who is setting the table for her husband, 2 days after he passed away, you might say, oh, the poor dear. But if she's still setting the table 2 years later, you think, oh, we've got a problem here. And there is that truth in the old saying, you have to say hello before you can say goodbye. And the unborn is generally still very present for the person who is suffering, for the post-abortive woman or man, because they haven't said hello to it, and so they can't say goodbye. And so with the denial, there is a lot of that head stuff going on. So-and-so really tried to talk me out of it. Guilt, 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 more guilt. But they won't allow themselves to get in touch with that heart stuff because for many it's just too painful. But what we know, a good example is that emergency workers, dealing with road traffic accidents, they have to get the job done. They've got this job to do. They have to stay focused. It doesn't matter what the trauma is. They have to get through it. And so too with abortion. Women are in survival mode. They've got to get this abortion. They've just got to make it go away and get back to some semblance of normality. But the difference is with emergency workers, you're often, who are involved in critical incidents, they often receive support afterwards. The community ensures this service is provided because they know that they've got to get in touch with their feelings to be able to deal with the trauma that they've just been through and to heal from it. But unfortunately for the post-abortive woman, she walks out of the abortion clinic and she may suicide. So she has to keep herself in this place of denial because it's safe. You often hear, I've had an abortion and it hasn't affected me, which is generally the person who is most affected in my experience in this work. It's like a war zone trauma. You come out and you feel safe. There's that relief. But then the dreams start and subconsciously they don't connect with what they're feeling with the abortion, and they struggle to articulate their thoughts and their feelings, and our society doesn't allow us to connect or empower us to connect. There's no safe place for them to, and so the woman comes out of the abortion clinic who bawls her eyes out. She's already connecting, but left untreated, from that point on, a woman suffering the effects of abortion trauma might suffer a myriad of symptoms that other people lightly unaware of or don't recognise. Sleep disruptions is a very common one. Nightmares. They'll experience flashbacks, and things that can produce flashbacks are like, sitting in the dentist chair. Women report the smell of a hospital, very, very common, will result in a flashback. The sound of a vacuum cleaner, so they can't clean their house, or they can't be home when their house is being cleaned. Anticipating disaster constantly, thinking something bad is going to happen, It's very common for post-abortive women to report suffering anxiety, terrible anxiety, hallucinations. They can be auditory or visual. Auditory being, the sound of children crying, and it can be the middle of the night and nobody's around, so it isn't considered normal. Or seeing children who are the same age as their unborn might have been. Acknowledging the common effects of abortion trauma is really just the tip of the iceberg, I suppose. Recognising its many presentations is the next challenge, and it's a really big one, because after you see it, it's certainly hard to look away, because you know in yourself that it must be addressed, whether it's in somebody very close to you, a sibling or a friend or somebody, a work colleague. After you have seen it, it's very hard not to acknowledge it, because you know that this person needs help, they need healing. So hopefully being aware of the common effects of abortion trauma will in some way help to help yourself or help others around you on the journey to awareness, recognition and healing.